Congress is now debating an extension to the temporary tax credits for Obamacare. Joining us to discuss is Tony Kinnett, national correspondent at the Daily Signal and host of the Tony Kinnett Cast radio show and podcast. So, Tony, good to have you here. Some numbers here. Obama premiums had already doubled since 2013, and by 2025, they were up nearly 133%. So what do you say about this? What is the fundamental cause?
Well, the fundamental cause, Don, good afternoon to you, is that the system was broken from the offset. The very framers of Obamacare, those legal analysts they pulled together to write the original Affordability Care Act options, admitted that it was doomed to fail from the start. There are those who believe there were political motives. There are some who just said that it was a kind of halfway between corporatist and socialist policy gone wrong. The fact of the matter is it didn't work for Americans. We were told it was going to be amazing, and it has failed and has needed to be propped up by bigger and bigger subsidies. So the question becomes, are we just going to subsidize it from now into eternity and therefore drive the cost to American taxpayers? Or are we going to reframe an entirely new system? Somewhere in the middle of that, Don, is the question is, how do you limp America off of the Affordability Care Act, the Obamacare system? You have to do it one way or another, because if you just cut it off, it's a big rug pull, let's say, then it's going to cause some severe dyspepsia in the market. And most importantly, those who don't spend their days paying attention to this 24/7 in news coverage, they're not going to know until their coverage has expired and they need medical care right away. So this has to be done with a scalpel, maybe more than a sledgehammer.
So, Tony, could you just address one argument here? Could the reason for the rise in cost in Obamacare premiums because of already high pharmaceutical prices and overall inflation in the healthcare sector?
I think that in a way that if your leg was broken, you might also have a stubbed toe. Yeah, sure, rising costs in pharmaceuticals could be a considerable issue. But the main issue is that the Obamacare subsidies are directly funding insurance companies. So they can just send the premiums higher and higher and higher. After all, your client's not going to pay those premiums. The insurance company is going to pay those premiums or request those premiums paid by the federal government. And so if you are, let's just pick a random insurance company out of thin air, Cigna, for example, Cigna will take a claim and they will say, well, you're on the Affordability Care Act, so therefore we will charge the government $4,000, where if perhaps that I was brokering one-on-one with Cigna, again, I'm just picking a random insurance company, I'm not saying anything about Cigna, just the first one that popped into my mind, then there would be a lower price negotiated. So this is one of the ways and reasons why the Trump administration is currently looking at health savings accounts and funding the employer provider of healthcare or Americans themselves directly for going into that insurer market. When you have a middleman, the middleman tends to do what all middlemen do. That's up the cost both ways, because after all, they're doing the facilitating. So why wouldn't they charge more?
So, Tony, can you just talk a bit more on what customers are getting out of this? How much choice does Obamacare provide to patients? And what about the health outcomes compared to private insurance?
So great question. The different sections and slivers of the Affordability Care Act, the different tiers in the model, don't provide the best care. In fact, there are those who can't get doctors that they had before the Obamacare, which again is ironic considering the if you like your doctor, you can keep your doctor lie. Of course, there's a system of care that link insurance networks to certain care facilities. For example, because of the reframing of the insurance market that came about as of Obamacare, even not being on the Affordability Care Act myself, I now have to travel dozens of miles just to get certain kinds of blood work done. And those who are glued to the Affordability Care Act program, they're lucky if, again, out in the Western United States, if they can even find care in their county or their section of the state, their congressional district, for crying out loud. So when we're looking at the reforming of the healthcare system in the United States, understanding that government subsidized programs have resulted in less choice, as they always have for every program throughout history. They've resulted in less efficiency, and therefore they have resulted in a lower standard of care. We can see this from the UK to Canada. Throwing government money at something is how you end up getting toilets that cost $45,000 and a nail that costs upwards of $3,000.
So, Tony, you talked about indefinitely subsidizing the program. Some
Yes.
more numbers here for you and our viewers. So subsidies have climbed to an estimated $138 billion per year. And on top of that, 80% of people are just paying $10 a month. So, I mean, how sustainable is this in the long term?
It's not, because again, as costs continue to rise, as insurance companies continue to eat up subsidization money, which by the way, I don't care what industry you're talking about, this is always how subsidization works. Especially, we've seen this in military contracting or governmental construction contracting. That's what I was alluding to earlier with the expensive toilets, or a scandal from the early 90s, the expensive hammers and nails of the early aughts and the late 90s. The idea that the subsidization can ever get smaller naturally has never occurred before. And so it has skyrocketed. You see this exponential curve on the chart of subsidization money funneling into the Affordability Care Act for more and more people to sit in that and only pay $10 a month. It's an incredible tax burden, but more so, it is a major hamper on the industries themselves because you're slowing down efficiency, which also compounds how expensive something is. So filling out 236 forms so that you're government compliant, you've paid $10. The system is being taxpayer funded out the wazoo. It's horribly ineffective and harmful for Americans.
So, Tony, I just want to end this conversation with potential solutions here. Do you think we should try to mend Obamacare's shortcomings, or should we replace it completely? What are the options?
I mean, the honest answer is if it's worth doing, it's worth doing right. We actually need to see a system in which the government deregulates the healthcare market, in which case I'm able to actually go and broker a price between my local doctor, between my insurer. There's no reason that in several states around this country, nurse practitioners need a doctor to look over their shoulder to provide acceptable care. You could deregulate a lot of this and get the middlemen out, and then there wouldn't be a need for heavy subsidization. Be tax breaks for health savings accounts for individuals who are spending money towards their healthcare expenses. These are common sense fixes that we have seen work in other countries around the world. I do think we're going to have to stair step off of this, just coming from the education field and science fields myself. When you cut a government program, you need to relax and phase out the program. Otherwise, you rug pull the people who are on it, who, given that it's a healthcare program, may not be in the best mental or physical state to readily change to a brand new program right off the bat. If you're going through a major series of surgeries and your healthcare suddenly ends, a rug pull is not the best option. A phase out's more, humanitarian, for crying out loud.
Well, all right, Tony, well said. Good to speak with you today. Thank you.
Don, always a pleasure.